In this video, we'll discuss delirium tremens, its causes, pathology, sign, symptom, and treatment. So what's delirium tremens? Delirium tremens is the most severe life-threatening manifestation of alcohol withdrawal. When does it occur? If after a long period of drinking being stopped abruptly, it leads to delirium tremens. Delirium tremens is characterized by delirium, that is confusion, agitation, and fluctuating level of consciousness. There is increased autonomic activity including tachycardia, tachypnea, and hypertension, diaphoresis, fever, tremors. There are seizures known as rum fit may also occur. They are tonic-clonic in nature. How about respiration? First, there is respiratory acidosis, then tachypnea, and then there is increased pH that leads to respiratory alkalosis. There also occur hallucination, which usually are auditory in nature. How about the symptoms? When do they appear and what's the peak of symptoms and when do they improve? Symptoms appear about 10 hours after stopping alcohol intake, and they become worse or peak in 2 to 3 days and improve on the 4th or 5th day, but they may last longer. What factors triggers delirium tremens? It may be triggered by head injury, infection, and abrupt stopping of tranquilizers and barbiturates also. What are the risk factors for delirium tremens? Age more than 30, concurrent illness, sustained drinking, and very high ethanol level for longer periods. Delirium tremens occur more in people with concomitant severe medical disorders. What are the main symptoms of delirium tremens? The main symptoms are rapid onset of confusion, disorientation, nightmares, agitation, paranoid delusions, autonomic hyperactivity, and severe uncontrolled tremors of the extremities. What are the psychiatric features of delirium tremens? Anxiety, panic attacks, paranoia, hallucination, usually auditory, and formication. What's formication? Formication or tactile hallucination is a feeling of bug crawling on the skin is known as formication. What's the mechanism of action of alcohol withdrawal? Alcohol causes endogenous GABA disinhibition, so GABAergic system is down-regulated. Number 2, alcohol inhibits NMDA receptor. When alcohol is withdrawn, excitatory glutamatergic system is stimulated. And number 3, upon alcohol withdrawal, sympathetic nervous system becomes hyperactive. What's the treatment of delirium tremens? Delirium tremens runs 3 to 5 day course regardless of therapy. So what should be the focus of care? Focus of care is to, number 1, identify and correct medical problem. Number 2, control behavior. And number 3, prevent injuries. What are the drugs used for delirium tremens? Benzodiazepines, especially high-dose chlorodiazepoxide, 800 mg a day. What does it do? It decreases agitation and raises seizure threshold. Second drug to be used in delirium tremens are antipsychotics such as haloperidol, ziprasidone, and olanzapine. These drugs may also be used as alternative choice to benzodiazepines. Antipsychotics are less likely to exacerbate confusion, but their disadvantage is that they may increase the risk of seizures. Third way of treatment is benzodiazepines combined with antipsychotics like haloperidol. The other treatment is fluid and electrolyte balance, vitamins like thiamine, and treatment of infection. How about the mortality rate? 5% with treatment and 20% without treatment.